Hello, I'm Justin Bakule, Executive Director of the Shared Value Initiative. Our initiative is in its third year of building a global community of leaders committed to the concept of shared value. We work with businesses to help them view the world's most pressing social and environmental challenges as opportunities for growth and innovation, as opportunities to create significant social and business value simultaneously. We firmly believe shared value has the potential to help make progress on the most pressing social and environmental issues of our day. And I wanted to tell a story about my own shared value journey, and by extension, what we do every day at the initiative. The year was 2005, and my wife and I were Peace Corps volunteers living in the Sahara Desert in northern Mali. We lived in Gao, a regional capital of about 40,000 people, primarily Songhai and Tuareg. Sitting astride the Niger River, camel caravans loaded with salt from Saharan salt mines would arrive at Gao's market, much as they have for the past 1,000 years. Put simply, it is one of the most challenging environments in one of the most impoverished countries in the world. My wife worked for the local SESCOM, or Community Health Center, and together we became involved with a child vaccination program, as sadly, northern Mali is one of the few places in the world where polio still exists. On the first morning of the program, all of the community health workers gathered at the SESCOM. We reviewed maps of the town and segmented the neighborhoods where we would each be responsible for vaccinating the children. And then we were given 3 simple tools for our work: a piece of chalk, an indelible marker, and vials of the polio vaccine in a styrofoam cooler. As we spread out to our assigned neighborhoods, we carried these 3 simple tools to help eradicate this crippling, preventable illness. After entering a family compound, we explained the reason for our visit and asked how many children lived there. We then dispensed the polio vaccine to each child present. Sometimes the kids were intrigued and took it right away, and in other cases, well, let's just say that kids everywhere are sometimes scared of medicine. We then used the marker to color in the pinky fingernail of the child. The chalk was then used to write a notation on the outer door of the compound. We drew a cross, and in the upper left quadrant, we wrote the number of children who lived in the household. And in the upper right quadrant, we wrote how many of them were present to receive the vaccine that day. At a glance, a returning vaccination team could know if all the children in the compound had been vaccinated. Since it only rained a few times a year, we knew the chalk notation would stay in place until we returned. While this story and the 3 tools involved are so simple and evocative of addressing a significant yet solvable global health problem, upon deeper reflection, the contours of complexity start to emerge. From the local community leaders, religious leaders, and parents who needed to support the vaccine campaign, to the national government policies needed to support eradication, to the global health organizations charged with eliminating polio, to the global and local nonprofits needed to deliver these programs, and to the companies who needed new innovations to develop the oral vaccine, the cold chain storage, and even simple, hygienic, single-use doses. For success, these complex elements have to act in absolute harmony, right down to the volunteers walking street to sandy street, carrying a piece of chalk, a marker, and vaccines. Put simply, this story illustrates what we do at the Shared Value Initiative. We fundamentally believe in both the power of the private sector to address social and environmental issues as opportunities for growth, but also that the private sector does not act alone, but in harmony with civil society and governments in unique and innovative ways. The initiative manages a global community of practice and sources the latest shared value, knowledge, information, and resources. We want each practitioner around the world to understand what works and doesn't, and how. And for each member of our community to understand and embrace the tools at their disposal to address the most pressing issues of our time. In essence, to find and use their own chalk, marker, and vaccine. Thank you.